Did you know that weak and shaky legs after the age of 60 aren't always just signs of aging? In many cases, the real culprit lies in how we supplement vitamins, especially two that are commonly misused. Vitamin D and vitamin B12 play a crucial role in muscle strength and balance, but when taken incorrectly, they can silently damage your legs, increase the risk of falls, and even lead to long-term mobility issues. Many people believe that taking more vitamins equals better health, but that's not true. Oversupplementation or poor management can cause more harm than good. In today's video, we'll dive deep into the two most problematic vitamins that may be weakening your legs without you realizing it. We'll uncover the scientific evidence behind these claims, what recent research has shown, and how to safely use these vitamins to protect your strength, mobility, and independence. Whether you're over 60 or caring for someone who is, this is a video you simply can't afford to miss. So stay tuned as we break it all down, clearly, accurately, and based on real science. Part 1: Vitamin D, the double-edged sword for your legs after 60. Vitamin D has long been seen as the golden key to healthy bones and muscles, especially for seniors. But what many people don't know is that if taken incorrectly, this seemingly helpful vitamin can become a double-edged sword, weakening your legs and increasing your risk of dangerous falls. Vitamin D helps the body absorb calcium and phosphorus, two essential minerals for maintaining bone density. But beyond bone health, vitamin D also directly affects muscle strength and function, particularly in the legs. A well-known study in the Netherlands, the Longitudinal Aging Study Amsterdam, published by Visser et al. In 2003, found that older adults with low vitamin D levels had weaker muscles and poor mobility. Another study published in the American Journal of Clinical Nutrition in 2023 tracked 136 adults aged 65 to 89 who took 2,000 IU of vitamin D daily for 1 year. Despite improved blood levels of vitamin D, there was no significant improvement in leg strength, walking speed, or balance compared to those who took a placebo. Why? Because not everyone is severely deficient in vitamin D. Many people supplement without knowing their actual blood levels, which not only provides no benefit, it can be harmful. A 2016 study published in JAMA Internal Medicine found that seniors taking high monthly doses of 60,000 IU had a significantly higher fall risk than those taking only 24,000 IU. The lesson? More is not always better. Globally, around 40 to 60% of people aged 60 and older are vitamin D deficient. This is often due to reduced absorption, limited sun exposure, and medications that interfere with vitamin D metabolism. However, blindly supplementing can lead to vitamin D toxicity, where excess calcium builds up in the blood. This causes muscle pain, kidney stones, abnormal heart rhythms, and ironically, muscle weakness, especially in the legs. Another large study, the DO Health trial in Europe, showed no major improvements in muscle mass or fall risk from vitamin D supplements in healthy older adults. These findings reinforce one thing: vitamin D should only be supplemented when deficiency is confirmed. Experts recommend testing blood levels of 25-hydroxyvitamin D. If your level is below 20 nanograms per milliliter, supplementation is usually necessary. The safe and effective dose is typically 800 to 2,000 IU daily. Taking megadoses without medical supervision is strongly discouraged. Beyond pills, vitamin D can be obtained naturally through sunlight and diet. Foods like salmon, sardines, eggs, fortified dairy, and mushrooms are excellent sources. Just 15 to 20 minutes of morning sun exposure can help maintain sufficient levels. To summarize, vitamin D is essential for bone and muscle health, but when misused, it can do more harm than good. Always check your levels, use the correct dosage, and consult your doctor before starting any supplement. Your legs and your safety depend on it. Part 2: Vitamin B12, the silent saboteur of leg strength after 60. Vitamin B12, also known as cobalamin, is crucial for nerve function and muscle performance, especially as we age. However, it's often overlooked or taken incorrectly, causing a silent decline in leg strength, coordination, and balance. After age 60, the body's ability to absorb B12 decreases due to reduced stomach acid or long-term use of medications like metformin or proton pump inhibitors. According to the CDC and NIH, up to 20% of older adults are deficient in B12, and the rate is even higher in those with digestive conditions. B12 maintains the protective myelin sheath around nerve fibers. When B12 is lacking, nerve conduction slows down, leading to numbness, tingling, and leg weakness. Many older adults experience these symptoms without knowing the root cause is a vitamin deficiency. A large Korean study between 2016 to 2019 followed over 3,000 adults aged 70 to 84 and found a clear association between low B12 levels and reduced muscle mass, especially in the lower body. A 2024 study published in Frontiers in Nutrition with over 2,300 participants also found that B12 deficiency led to reduced mobility and walking speed. High levels of homocysteine and methylmalonic acid, both linked to low B12, were shown to increase oxidative stress and damage muscle and nerve tissue, further weakening the legs. Intervention studies have shown promising results. A trial in India gave 100 micrograms of B12 daily for 3 months to older adults with mild deficiency. The group experienced significant improvements in leg strength and physical performance. Another study in Europe, the B-Proof trial, tracked hundreds of seniors for 2 years who supplemented with B12 and folate. While results were modest overall, those aged 80+ showed noticeable gains in walking speed and balance. However, like with vitamin D, random supplementation is not recommended. Although B12 is water-soluble and excess is usually excreted, taking unnecessarily high doses can disrupt digestion and interfere with other nutrients. Proper diagnosis is essential. A blood test for serum B12, homocysteine, and MMA can accurately determine if supplementation is needed. If confirmed deficient, typically below 200 mol/L, standard therapy includes 500 to 1,000 micrograms daily or regular intramuscular injections for those with poor absorption. After a few months, retesting is recommended to monitor improvement. Alongside supplements, a diet rich in B12, including liver, red meat, fish, eggs, dairy, and shellfish, supports long-term recovery. And as always, pairing this with regular strength training and balance exercises significantly boosts leg function. In short, vitamin B12 is essential for maintaining healthy nerves and muscles. Its deficiency can gradually weaken the legs and rob older adults of their independence. But with timely testing and proper treatment, this silent problem can be corrected and your mobility preserved. As you've seen, just 2 common vitamins, D and B12, when misused or neglected, can silently weaken your legs after 60. And it's not just about feeling tired or unsteady, it's about losing independence, mobility, and quality of life. That's why taking supplements isn't just about guessing or following trends. It's about listening to your body, getting regular checkups, and only supplementing when your body truly needs it. Protect your legs because they're your foundation for freedom in later years. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more in-depth health tips just like this. Thank you for watching, and stay strong, stay balanced, and stay informed.